lung cancers that can be inherited, but they're more rare.
Okay.
We know that colon cancer, for example, 10% of all colon cancers are probably related to an inherited gene that you inherit through the family. But that's only 10%. So 90% of colon cancers are probably related to some sort of multi-hit to the DNA, environmental, diet. Diet is a big implicated factor in colon cancer. And if you have that progression of factors, environmental, your dietary habits, even other personal habits, that might lead to the development of cancer. So, like I said, 90% of colon cancers probably are not genetic. Now, the future, as we learn more about the genes in the DNA and everything, we may find that a lot more cancers are actually inherited throughout our DNA. But right now, it looks like only about 10% of colon cancers. Breast and ovarian cancer also, when we look at those, somewhere around 10% of those are also inherited cancers through the family gene line.
Okay.
What happens if you feel that several generations have had this kind of cancer, like breast cancer? What can you do when you're young to prevent yourself from being in that position? Or
that's a very good question, and I think one of my goals is to work with the community and other doctors to really emphasize family history. That's one of the most important things. You can just take an interest in your family's history, which can be difficult because some people, it's hard to know what our grandparents or great-grandparents, what their health issues were because, at the time they didn't have very good diagnostic techniques. And also people who are adopted, they just don't know. But in general, I think that it's very important that we all learn our family history, know it well, that doctors inquire about family history with all their patients and their visits because with nowadays people go see all kinds of different specialists. So primary care, sometimes we don't see our primary care doctor very often, so you may see a specialist. Even specialists should ask about family history because they may find out an interesting family history that needs to be further looked into, and they can help work with the primary care doctor to get that person into some sort of genetic counseling or something. So family history is extremely important, and that's really where we start. We talk to people about mainly mom and dad, brothers, sisters, any of their own children. That's sort of the first degree relative. The second degree relative is aunts and uncles, cousins, and then it goes beyond that to third and fourth degree relatives, which are more distant relatives. But the first and second degree of relatives are very important that we know what kinds of health conditions they have. And I'm specializing in cancer, so I always worry about cancer, but other doctors would be concerned with their high blood pressure, diabetes, things like that are also syndromes or diseases that can be inherited, heart disease. So those are also important things, but we're going to focus on cancer, and that's what I focus on. And certain diseases are even, you can really see a pronounced family history. For example, I have a patient who her sister developed breast cancer in her 40s. And they also had her mother, their mother had breast cancer, but it was in the 40s and 50s, so the 1940s and 50s, so she ended up dying quickly, so they didn't know that much about her disease, but they knew she had breast cancer. So mom and a sister had breast cancer, and the sister was treated, and the patient that I had ended up coming to me because she ended up developing ovarian cancer. And breast and ovarian cancer is one particular syndrome that can run in families. And if we knew about that ahead of time, we can test people for this genetic mutation because it's a known genetic mutation, and we can talk a little bit more about that. But we could have tested that person and maybe taken her ovaries out ahead of time if we knew she had this genetic mutation to prevent ovarian cancer. So it was very unfortunate. It was a lot of young women in the family with breast cancer and then this patient with ovarian cancer. And it's probably something that if we know people have that kind of a family history, we can get them into surveillance programs where we do certain things to see if they have any abnormalities that need to be looked at. There are some surgeries that can be performed, like removing the ovaries after childbearing is complete to prevent ovarian cancer. There's new tests like an MRI, which is a fancy test looking at breast tissue that can pick up cancers early. These are all things that should be done in those families that are high risk. Now, we have to be careful about overusing some of this technology because it's very expensive, and as you know, with healthcare, the way it is now, we're in a crisis and we can't order these tests for everybody. So, in particular, things like breast MRIs and things like that, that's where we need to really look at family histories, find those high-risk people, get them into these screening programs, so we just look at them because they're the ones who have a high risk of cancer.
Now, you talked about actually testing for genetic mutations. Is that expensive, or how easy is it to do that for the patient?
That's actually something that's come out about recently. So in about the mid-90s, they developed a test to pick up or to find the genetic mutation for something called BRCA1. BRCA is the gene on the DNA that actually is the breast and ovarian cancer syndrome gene. So it basically, in those families, if they have that genetic mutation, women have a risk of about 70 to 80% chance that they will get breast cancer in their lifetime. That's huge.
Yeah.
Women have a risk of about 40 to 50% of getting ovarian cancer in their lifetime if they have this mutation. Men in the family have about a 6% risk of getting breast cancer, men with breast cancer.
Oh, wow.
And breast cancer in men is very rare. Probably 0.01% of the population of men will ever get breast cancer. But if this genetic mutation exists, they have a 6% chance of getting breast cancer in their lifetime. There are other cancers associated with this syndrome that we're learning more about: pancreas, prostate, uterine, things like that. So there's a whole syndrome of cancers. So they found this gene in the mid-90s. Subsequently, they've actually found a second gene called BRCA2. So now they have a test for both of those genes. This test is expensive because they have to look at the entire DNA and sequence it, and that's a very expensive process with a lot of high-tech machinery. Takes about anywhere from 2 to 4 weeks to do the test, and the test can run up to $2,000 or $3,000.
Oh, wow.
Thankfully, most insurance companies now are covering it, so that's good. However, again, we want to be careful about where we use these resources. They cover it in people who are appropriately screened, that have a high-risk family history, that we know it looks like they have a good chance that they might have the gene. So the test is pretty easy to perform, and that's a good example of a test that once, if let's say your mother had the genetic mutation and she had a history of breast and ovarian cancer or something like that, she has a 50% chance of passing it to her kids. So 1 out of every 2 of her children would inherit this gene. Now, all the children won't necessarily inherit it, so it's important to test the kids. And we, of course, only want to do that at an appropriate age, too. So typically, we don't do any testing until they're well into their 20s or 30s.
Okay.
Because that's essentially when we would begin any kind of testing or surveillance or mammograms or colonoscopies or anything like that. We certainly wouldn't do that in anyone who's young, less than 20 years old.
Okay.
How do alterations in those BRCA1 and 2 genes affect a person's risk of getting that type of cancer?
It's interesting. So BRCA1 and 2 are actual genes that we all have on our DNA. You and I, we all have them. BRCA1 and 2 are what we call genes that are tumor suppressor genes. So when they act normally, when there's not a mutation in the DNA, they're called tumor suppressor genes. So what their job is to suppress abnormal growth. So they go throughout our body, and anytime you have some abnormal growth, these genes actually help to suppress abnormal growth. So they're preventive cancer genes. And that's the normal function of these genes on the DNA. When you have a genetic mutation, which is what the mutation, when this test looks for, like, chinks in the DNA that cause the DNA to separate a little bit or something, or cause the mutation. You have a substitution of some part of it. In any case, when it's mutated, it can't act as a tumor suppressor gene anymore. So let's say you have breast tissue that's growing abnormally, and these tumor suppressor genes typically would suppress